We are back here with Dr. Shohen, Doctor of Physical Therapist, here at Atlantic Sports Health, Atlantic Health System. You know, really interesting stuff, Dr. Shohen. What makes a great physical therapist? I know you shared some things off camera. Why don't you share that with our audience?
Yeah, so I think when you meet a physical therapist for the first time, it's important that they give you a diagnosis. It's important that they give you a prognosis. And what that means is that they explain to you how long treatment will take and what they can expect during each treatment. And then also providing you with some bit of exercise or treatment that day or within the next treatment session.
Yeah. You said, sorry to interrupt, but you said also, too, which is really critical, are they hands-on or are they putting you on a machine? Because if they're putting you on some type of machine, might be a little bit of a red flag.
Correct. Anybody that's putting you on machines, hot packs, cold packs for too long, and not giving you a hands-on treatment, you're definitely missing the boat. And you should probably ask your physical therapist if there should be more hands-on or be in search of someone else.
Yeah, it's important, I believe firmly, obviously, hands-on therapy, and that's where this industry has gone. You know, the cutting-edge therapists, the great therapists are doing much more hands-on. Not that there's not room for a hot pack or cold pack. They have their place, but not nearly as much as maybe a lot of therapists use them.
Correct.
Yeah.
Yeah. So the hands-on approach, I mean, it could be anything from stretching, but there's manual trained physical therapists that should be able to mobilize your joints appropriately and safely so that you can make the gains that you're looking for. There's also instrument assisted soft tissue mobilization, which they can use metal or plastic objects to kind of make your tendons have reduced pain.
Yeah. And I believe, that's obviously has taken such a big step forward. The manual techniques that are used with the different objects, the metal, the plastic objects. Now, not necessarily fun to have treatment, right? It is painful, but they're breaking up a lot of that myofascia, those adhesions.
Correct.
That occur once you have a soft tissue injury. And I don't think most people truly understand when you injure soft tissue, right? The healing process occurs and you get this fascia buildup, and it becomes more like a felt-like material where the fascia, the collagen fibers kind of get stuck together like felt. Right. Felt is basically all different fibers kind of matted together with heat.
Right.
That's the last thing we want, right? We need our fascia to be flexible and pliable.
Correct.
And, there's a lot of new research coming out on fascia now, and we finally understand it because we have the imaging equipment to see it more clearly. And these manual techniques really help to break up and facilitate the fascia, facilitate the recovery. So I know that's something you do a lot. You've done a lot with your athletes, being a therapist for the New York Jets, and now, here at Atlantic Health, working with patients. So what are some of your, go-to techniques? What do you like the best?
Yeah, I mean, I personally love stretching and joint mobilization and instrument-assisted soft tissue mobilization when I'm hands-on with my patients. It has the best results, quickest results, and that's really what we're looking for.
Awesome. Great stuff. So when you look for your therapist to find a great PT, make sure they're doing manual therapy, make sure they've been a therapist for at least 5 years, and they're diving into that continued education. Thank you so much, Matt. Really appreciate it.
Thank you.